Bismillahirrahmanirrahim. Assalamu alaikum. Hi guys, welcome to my YouTube channel. This is Dr. Ghufran Babar, endocrinologist in America. Today is another video from PLAB series. We'll talk about how to prepare for PLAB-2 exam, the tips and tricks to pass the exam on first attempt. After PLAB-1 exam, you have up to 2 years and 4 attempts to clear the PLAB-2 exam. If those 2 years lapse or you do not pass the PLAB-2 exam in 4 attempts, then you have to take the PLAB-1 exam again. The cost of the test is about 840 British pounds, which can change, go up and down, and it can vary. And the test happens frequently compared to PLAB-1 exam. However, during COVID-19 epidemic, it is temporarily suspended, but will restart when things improve. So it is another step towards getting British General Medical Council registration. And the test usually takes place in England, in Manchester. So after clearing your PLAB-1, you need to apply for a visa and come here to Manchester in UK to take the test, and you have to apply for the exam. And like I said, the fee could be up to 840 pounds. Some people prefer to take some preparation course. The structure of the exam is OSCE, which is Objective Structured Clinical Exam. So there are PLAB preparation courses, which can be up to 500 to 700 pounds that you can take to prepare for the exam. The exam books are also available, which you could utilize. There are Foundation Year 2 PDF notes, which are available that you can utilize. Oxford Foundation Yearbook 2 textbook, you can use it. Facebook groups, WhatsApp groups, which you can learn the cases, ask questions. PLAB strategies, the role of a junior doctor, you can follow that. History taking and differential diagnosis books, and clinical methods books you can follow. NHS Common Diseases Part 1. These are different resources other than doing a PLAB preparation course, which can assist you to prepare for the exam. So what does exam include? Like I said, it is an OSCE based exam. Usually there are 18 stations for the exam and 8 stations per 8 minutes per station. 2 stations are rest stations, and so you wait outside for 2 minutes, and then you are inside with the patient, with the case for 8 minutes, so up to 10 minutes is total time spent. And the total duration of the test is about 3 hours and 10 minutes. You have to be really energetic during this 190-minute test, and use your assessment skills, history taking, physical exam, practical procedures, and investigations leading to diagnosis. And in terms of the exam itself, like I said, it will include the history taking or data gathering, management, and interpersonal skills. So these 3, and each will have 4 marks, so up to 12 marks per case would be allocated. And out of total of 216 marks, you have to take at least 130 and pass 11 of the 18 stations to be declared pass for PLAB-2 exam. And so history taking, management, and interpersonal skills, so each has 4 marks. So during the exam, be yourself, express your confidence, have a good smile on the face, and good body language, positive attitude, their verbal and non-verbal cues, very sympathetic attitude, empathize with your patients. So interpersonal skills and your English fluency will be a pivotal thing in helping you to pass the exam. So those people who have accent are from countries where English is not their birth language, they need to speak slowly. The slower you speak, the better you will be able to ask questions, give information to your patient, to your examiner, and try to speak slowly in clear words. And also pay very close attention to your patient or examiner and try not to repeat questions and not to ask again unless it's really needed. So you have to pay very, very close attention to their accent. So you have to make sure that you are used to British accent, listen to people, watch British movies that can help you catch the words easily. So in terms of the process, when you come in on an exam center, you will be asked to wait in a waiting room, and then you will be called in to see your ID, which could be a British driver's license or your passport from your country of origin, and it should have your photograph should be recent. You will be given a badge and will have a specific color which will show which zone of the circuit you will be assigned to. You will be given a briefing about the exam, how it will be conducted on the exam day. You will be taken to a place where you will have a locker. You place your belongings, your books, anything you have brought, your personal stethoscope. They will provide you everything. So you don't need to bring anything. And you can place your cell phone, your rings, make sure your cell phones are turned off, your wristwatches, everything you have to make sure. Don't bring too many things. And then you will, after the briefing, before the exam process begins, and they will explain you the exam during the briefing, and then you can use a toilet, and then there will be circuit of OSCE stations where you will wait. There will be statement written outside, which will be about 1.5 minutes wait. You can read a brief description about the patient and wait outside, and then you will be called to go in. Make sure you use the hand sanitizer and demonstrate that you're using it and you've used it, and then you go into the room. And whatever task you are given, you perform the task. The examiner is in the room, and you may have a simulated patient or some other thing that you have to do. There may be a mannequin where you have to demonstrate your skills. You may have some procedure that you have to do, and you have another copy of information sheet inside the room. So in case you forgot, you can reread the instructions. And at 6 minutes, you will hear a sound which will tell you that you have only 2 minutes left. And then you make up your differential diagnosis if you have a case of chest pain, and you wrap it up and give the management. And then you do the same thing, come out of the room and go on with the next case. And there could be, like I said, an actor, a mannequin or model that you will be assigned, and an observer sometimes may be present to watch the exam. Sometimes part of it may be recorded for quality purposes. Usually the examiner does not interrupt you. They just observe you, your manners, your history taking decisions and skills, your examination, your data gathering, your management plans, your interpersonal skills, your English fluency. So they'll just be watching, and once you are done, you can leave. They will not interrupt you unless you are doing a grossly abnormal thing or you're causing pain to the patient or the examiner, the simulated patient. Then they may interrupt, otherwise they will not. and 2 stations are for relaxation. You can drink water and relax, and after that you will be given, once you have completed all the 18 stations, you make sure that you maintain high energy until the last station, because it's a make or break deal. You need to attain passing marks at least 130, as close to 212 as possible. Once the exam gets done, thank you everyone, stay quiet, collect your belongings, do not discuss cases, keep your cell phone turned off, and then you will go out, and you may get the result in about 4 weeks on your GMC website, and it could also be sent you through your valid email that you have attained. In case of these cases, you will be given different types of cases depending upon what is the case that you may be offered. There could be an abdominal exam that you may be asked to conduct, so make sure your clinical methods are good: history, inspection, palpation, percussion, and auscultation. You may be asked to see a patient with abdominal pain. You may be asked to get a arterial blood gas sampling, oligomenorrhea, discuss management and pain relief. These are some of the cases that have searched and found on the web: amenorrhea counseling, amitriptyline counseling, side effects, ankle strain management. So common things: anorexia nervosa, history taking and management; so antepartum hemorrhage, history taking and management; antidepressant counseling, appendicitis in a child, exam and counsel a parent that what are you going to do, what is going to happen to your child. So counseling is very important, which again involves your interpersonal skills. Asthmatic patient, counsel regarding treatment with albuterol, steroid inhaler. You may be asked to demonstrate how to use a spacer or aerochamber, prednisolone tablets, what is their role. So you may be asked. You may be asked about the basic life support procedures, arterial or venous blood sampling collection, blood pressure measurement, breast examination, especially if there is a female who needs an exam for risk of malignancy, breathlessness, if there's a patient, maybe asthma, maybe congestive cardiac failure or something else, you should know the differential diagnosis, left ventricular failure. Then you may be asked about counseling about carbamazepine. You may be asked to do urinary catheterization, cervical smear, chest pain history and differential diagnosis, child abuse history, chronic back pain, uncontrolled with paracetamol. Discuss further management. What are the other options of pain management which are available? Chronic fatigue syndrome history and counseling. Colposcopy, comatose patient, neurological exam. So again, your physical exams are really, really important. A child who is seizing or convulsions, you have post-convulsions, post-ictal, history taking and counseling to the parents. Constipation history from a nurse patient on dihydrocodone. Explain that it is maybe because of the hydrocodone. Cough in a smoker, history, risk of cancer. CPR in an adult can be asked, CPR in a child. So you may be asked about basic life support, cranial nerve examination, cranial nerve 2 exam, homonomous heminopia, or 7, which is Bell's palsy. Cardiovascular exam, they may ask you to examine the cardiovascular system. So these are the common cases that you may come across. Depression after CNS depression, or depression after whiplash injury, you have to counsel. Depression as such, you have to take the history and demonstrate management points. Depression, I discussed. Diabetic foot exam, look for capillary refill, DKA management. Diabetic patient annual checkup, what are the labs that need to be done, what are the screening labs. diarrhea in a child, counseling the mother about oral rehydration or IV hydration, dizziness, examine the 8th cranial nerve, dizziness history and differential diagnosis. So you should know what is dizziness, what are the causes, how to manage, what is the treatment, dose calculation for a drug abuse counseling like heroin when the patient wants to quit this. Dysmenorrhea, take history and discuss management with the examiner. Dysphagia, history taking. Dysuria, burning and poor stream, history and counseling, discuss management. Then you go on to, they may ask you to examine the ear with the otoscope, with the tuning fork, eclampsia counseling, ectopic pregnancy counseling, patient wants to go home, epilepsy, newly diagnosed patient, how would you counsel, explain the diagnosis, management strategies, investigations, long-term course, epilepsy, which is uncontrolled on carbamazepine, history and counseling, what are treatment options, excessive cry in a baby, is it colic, is it sepsis, counsel the mom, falling on an outstretched arm, having fracture, discuss management with the examiner, the scaphoid fracture, febrile convulsions in a child, history taking and exam, femur fracture, secondary survey, fever, history of which could be pneumonia, fever in a 2-year-old, counsel the mother, foreign body ingestion, counsel the mom what to do if she's suspecting foreign body in down the line in future, fundoscopy, how to carry out fundoscopy, gonorrhea, sexually transmitted diseases, history taking, counseling, contact tracing, GCS assessment and neurological exam, Glasgow Coma scale, what is Glasgow Coma scale, how do you do it, patient who's having hemoptysis, elderly patient, history taking, hemorrhage on fundoscopy in a child, could be child abuse. You have to tell them headache counseling, cluster headaches, headache history, head examination, heart failure examination, hematuria, history and management, bladder carcinoma, hemicolectomy, post-op bleeding, phone consultation. You have to talk with your physician, who is your attending, give them information. Then herniorrhaphy, post-op counseling, infection and bleeding at the operative site, herniorrhaphy, pre-op counseling, hip examination, pain, osteoarthritis, meniscal rupture in the knee joint, hoarseness of voice, history and differential diagnosis, Hodgkin's lymphoma, annual checkup, examine lymph nodes, lymphoreticular system, hemiparesis, hyperemesis gravidarum, take history and discuss simple management, idiopathic epilepsy in a child, ingrowing toenail, alcoholic patient with raised MCV, history and counseling, intestinal obstruction in a 72-year-old, phone consult, and tell your consultant, interception in a child, take history from the mother, what are the points on the history that will help you in diagnosis, irritable bowel syndrome, irritable hip syndrome in a child, counsel mother, IV cannulation, knee examination is very important. So learn to examine the knee joint, left iliac fossa pain, could be post IUD insertion, ectopic pregnancy, left ventricular failure counseling, lymph node exam, LOC history, lower spine examination, melena since 4 years, history, meningitis counseling, meningitis emergency management, meningitis in a child, phone conversation with a parent, meningococcal septicemia, counsel the mom, menorrhagia, history and counseling, mesothelioma, breaking the bad news. So you have to be very, very, very sympathetic with the patient, empathize, feel the pain of the family when you give the cancer news, be very sympathetic, migraine counseling, mini mental state examination, myocardial infarction, pre-discharge counseling, what are the risk factors, how it could reoccur, which will be the treatment, future course, myocardial infarction, discuss EKG, X-ray, and management with the examiner, myocardial infarction with left ventricular failure management, MMR, vaccine counseling, multiple drug abuse history taking and treatment, multiple trauma in a child after road traffic accident, femur fracture, spleen rupture, counsel mother. So these could be the common cases on your OSCE. Other than that, neonatal jaundice. You have to tell mom about the jaundice in the child. A non-accidental injury on a comatose patient, a baby, neurological exam in a comatose patient, non-accidental injury in 85-year-old elderly abuse. You have to remember that. Obesity counsel, patient refused surgery by now they have come to you, what else can I do, healthier lifestyles, or if they want to go for surgery, bariatric surgery counseling, osteoporosis management, otoscopy we discussed, ovarian cystectomy by phenol-steel incision, pre-op counseling, palpitation history, paracetamol poisoning, someone has poisoning or overdose with paracetamol, postnatal depression, history and management, premature menopause, history, pre-op assessment, primary survey, prostatic cancer counseling, pain control, wants to go home. So these are other types of OSCE patients. Respiratory function test, and PEFR, respiratory system exam, rheumatoid arthritis counseling, rheumatoid arthritis management, right iliac fossa pain, history, differential diagnosis, appendicitis management, schizophrenia exam, scrotal lump, could be torsion, could be varicocele, could be fluid in the scrotal sac, scrotal lump counsel, could be cancer, secondary amenorrhea counseling, secondary survey, femur fracture, sensory exam at the lower limbs, sensory system exam with reflexes alcoholic patient, spacer counseling, STD checkup counseling, STD counseling, sterilization in female counseling, sterilization in male counseling, suturing. You will be asked about the suturing technique, how to do it. Terminal illness counseling, daughter in pain relief and palliative care, team management involvement. Thyroid exam, relevant systemic features, could it be thyroid nodule, could be thyrotoxicosis, TIA history and counseling, travel history like malaria, upper abdominal pain history, upper abdominal exam, Murphy's sign, urinary incontinence history and counseling, venipuncture, venesection in an anemic patient, vomiting history and counseling, how to manage, what is the differential diagnosis of vomiting, vomiting in a child, weight gain, very obese patient, take history, the nutrition, the lifestyle, feeding history, exercise, weight loss, thyrotoxicosis, anorexia nervosa, weight loss in a child history, whiplash, so malnutrition, kwashiorkor, weight loss in whiplash injury in depression, with depression counseling, whiplash injury with neck stiffness counseling, wheezing, asthma management, history taking, wrist pain, history and management, scaphoid fracture. So these are some of the OSCE presentations that you will be presented. There may be so many other, but I've given you some examples to begin with and try to follow these. Hopefully your 18 cases could be one of these. So in your data gathering, clinical management, interpersonal skills, you could be given grade A to E. A could be excellent, B could be good, C satisfactory, D fail, and E is severe fail. So you have to make sure whatever you are doing, do it well, because all these things will count. And make sure you are dressed nicely with nice clean shirt, half sleeves or full sleeves, no wristwatch, ring or bracelet, decently dressed for female, make sure no jeans, and you will be given the ID, and that has got your GMC number, name, and you will be scored based on them. Do not bring any equipment. Most important thing is interpersonal skills. Interpersonal skills. Be very nice. Practice to be nice. Practice physical exams. Practice talking to a patient with a smile. counseling, make sure you practice counseling, and make sure you watch English movies to catch the British accent so that you feel comfortable getting the information. You have an accent, speak slowly. You have an accent, speak slowly. And make sure that you're normal. Make sure you're seeing a patient on a daily basis. Make sure you advise on everything. Speak with a relative clearly. Communication is the key. Verbal English language skills are key. Practice to speak English. The role player, the simulated patient has to understand what you are saying. Examiner has to understand what you are saying. You need to demonstrate that you really understand the orders and you're really concerned about your patient's health when you are counseling. Make sure when you break the bad news, be very nice, as if it's your own family member, that you are and understand the emotional difficult situation, and be very sympathetic to a bereaved relative. Show compassion, and that is something you have to really practice on. You have to adapt during the exam and make sure your consultation is good. Time management. Time will run away. Make sure that your questions are methodical and to the point towards your possible diagnosis, and you have to finish it in 6 minutes so that in 2 minutes you can discuss the patient and develop a good rapport with the patient. And make sure that you are nice. Always smile, thank you, and help your patient, and make sure you ask about any pain, so that if there is any pain, you have to be very gentle. Once you clear the PLAB-2 exam, you have to apply for GMC, complete registration, and you can apply for jobs. Submit the documents. Make sure you get all the documents. You can get some shadowing with UK consultants. Sometimes you get paid, sometimes you don't get paid. Short duration. Get exposed to NHS environment to take reference for your job application. Remember, your references are very important. Make sure you will be interviewed by Skype. Make sure your passport is ready. You have your degree, your internship certificate, your IELTS score, your certificate of good understanding, PLAB-1 and PLAB-2 exam, and then you will be submitting your application. Selection depends on your eligibility, different terms. You will have different options to work in NHS system. Make sure you work and get whatever position you can get. Once you have some kind of position, you can go and advance and get a better position. So just you can get as intern level, FY2 level, and then down the line you can eventually become a consultant. And other pathway is MRCP, MRCS, or MRCOG, where jobs are less. You can become medical specialist, OBGYN, psychiatrist. More competitive are dermatology, radiology, ENT. But in primary care, as a GP, you are in high demand. ER, ICU, all those fields are good. You may be given up to 2,500 British pounds. You may have option of locums, and consultants you can go up to 6,000 to 8,000 British pounds. So life in UK is nice, is easy compared to coming to America, where there are more exams. It's relatively easy. You can get the job after PLAB-2, prepare your MRCP 1, 2, do get a better job, consultant. You can go back to your home country using this specialization, and you can experience UK experience and have a better life. So I hope this video is a bird eye view, have taken you over the PLAB-2 exam. I've given you so many options of OSCE tests. I have made sure you read a good history taking book. Be very objective in your questions. Try to learn about your patient. Be very nice to your patient. Physical exam, Hutchison's clinical method book, other clinical methods book, inspection, palpation, percussion, auscultation. Go through the differential diagnosis book. Make sure you have a good fund of knowledge. And interpersonal skills, make sure you use the hand sanitizer. Thank you your patient, get permission, thank you your examiner, have a smile on the face, be very positive, have a good confidence, good body language, believe in your abilities and your competence, and you will really do well on PLAB-2 exam and will be able to succeed in UK and NHS health system. I wish you best of luck. Please like this video if you've learned something, subscribe to my video and watch my PLAB-1 exam videos as well. I wish you best of luck. May God help you in your future careers and life, and please be safe and be happy. Sallallahu alaihi wa alihi wa sallam. Thank you and have a good day.